let me ask you, doctor, about this. The parathyroid was involved? Yes. What is the parathyroid? It is a ductless gland near the thyroid gland. And was there any inflammation there? Yes, there was parotitis. What is parotitis? Parotitis is an inflammation of the parotid gland. And was there any involvement of the pericardium? Yes, the double membranous sac enclosing the heart was involved. It is called the pericardium. Was there any inflammation present? Yes, there was pericarditis, which is an inflammation of the pericardium. And the peritoneum does what? It covers the uterus. And that is called perimetrium? Yes, perimetrium. And what is the periosteum? The periosteum is the membrane that invests and nourishes the bone. And was there any periostitis there? Well, periostitis is an inflammation of the periosteum, and I did not find any inflammation. Was it precancerous? No. Before the development of carcinoma, I did not find any evidence. Precordium? Well, precordium simply means in the region over the heart. What is preeclampsia? Preeclampsia is the eclampsia before delivery. Eclampsia is a major toxemia during pregnancy. Doctor, what is prepatellar bursitis? Prepatellar bursitis is an inflammation of the bursa in front of the patella, or kneecap. And the presentation was what? The presentation was simply the manner of the fetus presenting itself at the cervix. Doctor, what is procedentia? Procedentia is the complete prolapse, especially of the uterus. And was there a prognosis of anything like that here? No. The prediction was the end of disease. Was there a prolapse? There was no prolapse. What is a prolapse? A prolapse is a downward displacement of an organ at the rectum or the uterus. Doctor, what is retroflexion? Retroflexion is a bending or flexing backward, for example, of the uterus. And what is retrogassarian? Retrogassarian means a transection of the posterior root of the retrogassarian ganglion. And is that retroperitoneal? It is retroperitoneal because it is located behind the peritoneum. And what is retroversion? Retroversion is a state of being turned back, for example, of the uterus. Did you examine the semicircular canal? I did. What is the semicircular canal? It is one of the three canals in the labyrinth of the ear. And was there any semicoma? No. There was a mild degree of coma, but not semicoma. What is the semilunar valve? The semilunar valve is one leaf of a double door. The half-moon-shaped valves of the aorta and pulmonary arteries are termed the semilunar valves. Doctor, the subclavicular is beneath what? It is beneath the clavicle or collarbone. And what is subcostal? Subcostal means beneath the ribs. What is subinvolution? Subinvolution is the failure of the uterus to reduce to normal size after childbirth. And suppuration? Suppuration simply means the process of pus formation. I found some pus formation in the area. And what is supernatant? Supernatant means above or floating on the surface. And supraoccipital? Supraoccipital refers to the occiput, which is the back part of the skull. It is situated above the occiput. And the suprapubic area? The suprapubic area, the bone of the pelvis, makes for a surgical opening into the bladder from above the symphysis pubis. What is the suprarenal area? That is the kidney, the adrenal gland above the kidney. And symphysis pubis? Well, symphysis pubis means the fusion of pubic bones on midline anteriorly. What is the synarthrosis? The synarthrosis is an immovable joint. And the syndactylism? Syndactylism is a fusion of two or more fingers or toes. It is referring to the webbing. And trifacial? Trifacial is the fifth cranial nerve. Doctor, let me ask you this. The lesions were part of the acne albida? Yes, the white nodules or milia on the face. And were there burns present? Yes, the effect of exposure to heat, chemicals, electricity, or sunshine. Sometimes first-degree burns, that is redness or hyperemia, involving superficial layers of the skin. And were there any second-degree burns, doctor? Well, second degree would be blisters or vesication involving deeper layers of skin.